In this video, we'll be discussing the components of the cardiopulmonary screen. The cardiopulmonary screen consists of medical history, vital signs, structure and observation, lung percussion, chest motion, lung auscultation, and heart auscultation. The patient's past medical history and functional limitations must be reviewed. Measure the patient's heart rate, respiratory rate, blood pressure, and pulse oximetry. Changes in the body structure can indicate cardiopulmonary dysfunction. During an integumentary test, check for capillary refill, skin temperature, nail clubbing, and cyanosis. Perform a posture examination, looking at the patient's front, side, and back. When percussing, 2 fingers tap the middle digit of the opposite hand, as shown. Percuss the lungs at 3 spots bilaterally on the front, back, and side. Each lobe of the lungs is percussed in the intercostal spaces of the chest, and the quality of the sound produced is assessed. There are 3 sounds to listen for: normal, dull, or tympanic. Both dull and tympanic sounds are abnormal findings that may warrant further testing or referral. By palpating the patient's abdomen and their chest, it can be determined if the patient uses their diaphragm or their accessory muscles more for breathing. When auscultating the patient's lungs, a total of 18 locations must be examined using the diaphragm of the stethoscope. For each spot auscultated, ask the patient to take a deep breath. Alternating from one side to the other, the anterior, posterior, and mid-axillary regions must be observed and any irregular findings noted. Auscultation of the heart is performed to listen to the closing of the 4 valves. To be able to properly listen to all valves, 4 regions of the chest must be auscultated. The aortic valve can be auscultated in the right second intercostal space adjacent to the sternum. The pulmonary valve in the left second intercostal space adjacent to the sternum. The tricuspid valve in the left fourth or fifth intercostal space adjacent to the sternum. Finally, the mitral valve is most easily listened to in the left fifth intercostal space near the midclavicular line. The position of the heart in a normally seated patient may not be in a suitable position for auscultation. In these instances, the patient may be directed to lean forward or positioned in a right side-lying position. It is important to use both the bell and diaphragm sides of the stethoscope. The diaphragm is best suited for higher pitched sounds. The bell is best for detecting lower pitched sounds like some heart murmurs.